All right, I'll go ahead and call this emergency meeting of the Tennessee Opioid Abatement Council to order on April 28, 2025. Thanks, everybody, for joining us. I'm Dr. Stephen Lloyd. I'm the chair of the Opioid Abatement Council.
And good afternoon. I'm Mary Shelton, Executive Director of the Opioid Abatement Council.
Thanks, Mary. We have 10 of our council members present, so we do have a quorum. If we could, real quick, if you could do a roll call of the council members,
sure.
Just so we can know who they are.
Armando Fontes, Bron Buck,
Here.
Casey Cox, Sharm Allen,
Here.
Clay Jackson, Karen Pershing, here. Ken Moore,
Here.
Lisa Tipton,
Here.
Mike Flynn,
Here.
Shane Sexton,
Here.
Stephanie Vanterpool,
Here.
Steve Lloyd,
Here.
Tim Fournette, Tommy Farmer,
Here.
Wayne Wyckoff. All right.
All right, so Mary, we do have a quorum, and if we could have the other our staff, and if Commissioner Williams is on, please introduce them.
All right. I talked to Commissioner earlier today, and she's in DC. I do not see that she's on, and I do not see that Matt is on. So, Sean.
Hey, good afternoon. Sean Smith, Deputy Director with the Opioid Abatement Council.
Sam.
Hey everyone, Sam Buckley, counsel to the Opioid Abatement Council.
And then, so JP Urban is out on leave for a few weeks. So in his place is Rachel. Rachel.
Good afternoon, everyone. Rachel Appel with the Tennessee Attorney General's Office.
And then we have a guest speaker, Tony Jackson.
Tony Jackson here. I'm the Director of Prevention and Division of Substance Use Services in the department.
All right, thanks, Marion. I would be remiss if I didn't mention, Tony, that you went ahead and got a haircut, and I'm greatly disappointed. All right, Mary, if you would proceed with our OAC staff updates.
Yes, absolutely. So I'm sad to report that Elizabeth Rickman Baden, today was her last day with the Opioid Abatement Council, and we wish her the very best. But this is comings and going. So we did gain a new staff member last Monday, David Lewis. He is the Opioid Abatement Council's Quality Director. His first day was the April 21st, and he's already going to present 2 slides today. So I'm super pumped about that.
Well, welcome, David. We'll baptize you by fire. So glad to have you. And Elizabeth, I hate to see you go. We've enjoyed definitely working with you, and certainly appreciate your input and your ideas, particularly around having people with lived experience being more involved in this process. So thank you for that, Elizabeth. And Mary, do you want me to read that, or do you want to? I can actually see it if you would like me to.
Yeah, go ahead.
All right. So we need to read our medical necessity for an emergency meeting, or not medical necessity, emergency meeting necessity statement. The Opioid Abatement Council is holding this 100% virtual emergency meeting to expedite the planning and design of the county funding and community grant applications process to meet the expected tasks and activities. The OAC finds that these matters to be considered require timely action by the council, that physical presence by a quorum of the members is not practical within the period of time requiring action, and the participation by a quorum of the members by electronic or other means of communication is necessary. All right, so we'll proceed with a roll call vote on the meeting necessity, the emergency meeting necessity. And I will entertain the idea for a motion to accept this.
Mr. Chairman, Clay, so moved.
I have a motion by Dr. Jackson, and welcome, Dr. Jackson. Do I have a second?
I'll second.
I think second. I'm not sure. I'm not good on voices at Sharm. That may have been Sharm. So if it was, then we have a second by General Allen. And so is there any discussion? All right, hearing none, Mary, would you proceed with the roll call vote?
Yes. Armando Fontes, Bron Buck,
Yes.
Casey Cox, Sharm Allen,
Yes.
Clay Jackson,
Yes.
Karen Pershing,
Yes.
Ken Moore,
Yes.
Lisa Tipton,
Yeah.
Mike Flynn,
Yes.
Shane Sexton,
Yes. Yes.
Stephanie Vanderpool,
Yes.
Steve Lloyd,
Yes.
Tim Fournette, Tommy Farmer,
Yes.
Wayne Wyckoff.
Yes.
All right, Wayne
All
is
right.
here.
So the motion carries, and welcome, Mr. Wyckoff.
All right, here is our agenda for today. We've got about 4 items that we will be requesting a motion and a vote from the Opioid Abatement Council. First up, the chair requested that we give an update on the invoice payments for the Community Grant Cycle 1, and this is fantastic news. We are paying out around $17.6 million as of this week and last week. So thanks to all of our community grantee Cycle 1 folks for doing the great work out there in Tennessee and submitting the clean invoices so that we can process those and pay them. Any questions on that, Steve?
I want to comment on it. We have our pre-meeting, Mary and Sean and I, we have a secret meeting place where we eat more breakfast than we need to. But I was really excited about this because this is not just money that's been allocated. This is money that's being spent. And so very excited about this and watching this number continue to grow, because this is money this is money that's in our communities. And so I don't know if anybody else has any comments, but really exciting news for us, Mary.
Thank you. And just a reminder, if you are not an Opioid Abatement Council member, if you could please turn off your camera, that will allow us to see the council members. Thank you. All right, so at this time, I would like to turn it over to Sean to present on MTSU and hustle recovery. And Sean, if you could just say for me to forward the slides as you're ready.
Okay, thank you. Hey, good afternoon again, council members. So I wanted to provide an update based on the last, excuse me, OAC emergency meeting that we had in January, where the council had approved a motion for the Opioid Abatement Council office to work directly with MTSU and hustle recovery for the purposes of negotiating their contract. These first 2 slides here, excuse me, is just a summary of the 2 contracts that are in question here with MTSU. And one is for the expansion of capacity for respite housing. And that's $5.3 million over a course of 3 years. The next contract is for the expansion of infrastructure and service capacity for a residential aftercare program. This one is for approximately $3.3 million, again, for 3 years. Since January, we have worked very closely with MTSU and Hustle Recovery, and for the purposes of negotiating their contract. We also had a meeting with the comptroller's office to get feedback from them in terms of how we should best move forward with contracting with MTSU and or Hustle Recovery. The feedback that we received from the comptroller's office was that they basically recommended that if we contracted directly with MTSU, they recommended that there be a subcontract between MTSU and Hustle Recovery for those services that Hustle Recovery would be providing. Next slide, please. Thank you. So since that time, MTSU has revised their budget plan and grant project for both contracts to remove the vans from both contracts. So the first contract had, that's contract ending with 1566. There were 6 vans that were a part of that contract. And the second contract ending with 1730, there were a total of 4 vans. Those vans have been removed from the revised budget for both contracts. The total amount that was originally allocated for those vans, total of 10 vans, was $400,000. What MTSU is proposing in their revised budget plan is to reallocate that $400,000 for 2 contracts to mileage. When we got the original, the revised budget, we did have some concerns with that just because of the significant amount of money that's being reallocated to mileage. This slide right here, because we did ask MTSU to provide a justification, which they did. Part of their justification for the increase in mileage was due to one, because in the original contracts, the mileage that was allocated was based on an anticipated utilization of mileage rather than the actual mileage. And so when they looked at the actual mileage, that was significantly greater than what the anticipated utilization was. What they also did is they said that the revised budget was based on a 3-month average of actual expenses. And so we'll go to the next slide. What I've tried to do is based on, questions from our one-on-one meetings, tried to kind of highlight what the breaking down the actual mileage over the 3-month average that they had provided. So if you see here for the 2 contracts, you see a breakdown of what the actual mileage was January through March for each of the contracts. And this is an average. And then we've compared that with an average over 3 months for what the revised budget is and those the revised miles for the revised budget. Any questions before I move to the next slide? Okay. Thank you, Mary. We can move on. This slide here is basically compares the original budget and the miles part of the original budget with the revised budget. So if you see here for the first contract ending 1566, for each year, the original budget allocated $50,000 for each 3 years. And now that's been revised to an increase of $130,000 per year. And again, the same with the second contract. And what MTSU has informed us is that the mileage, of course, this is at a reimbursement rate of 70 cents per mile, that this is inclusive of the cost of fuel, maintenance, repairs to transport clients to and from appointments. I also want to point out is that the increase in mileage, the increase or the $400,000 that's been reallocated to the both contracts does not change the total budget amount for each contract. So that has stayed the same. Next slide, please. As a part of the justification, MTSU did inform us is that they do plan to have a really good oversight plan in terms of how they're going to oversee hustle recovery's mileage expenses, to include developing a mileage log that hustle recovery is going to be required to submit to MTSU on a monthly basis. They're also going to hire a program coordinator who's also going to be responsible for reviewing and overseeing the mileage logs, but also the reports that's going to be based on the Life 360 application. And that's a app that Hustle Recovery uses to utilize and track the business usage of their vehicles. Next slide, please. Thank you. The next 2 slides here kind of illustrates the types of vehicles that Hustle Recovery is going to use, keeping in mind that we're not going to be paying for these vehicles, but we will be paying for the mileage based on the usage of these vehicles. So there's a total of 9 vehicles that are actually going to be owned by Hustle Recovery. And then the next slide illustrates those vehicles that are going to be non-owned hired vehicles. And so hired means here is that these are going to be vehicles that are going to be owned by Hustle Recovery staff. These vehicles are going to be covered under an auto liability for the hired vehicles with a $1 million coverage and a $2 million umbrella policy. Again, the mileage will be reimbursed by the opioid abatement settlement or the grant funds here, and that's going to be for the wear and tear of the vehicles. Next slide. Thank you. So based on MTSU's revised budget plan and grant project for both contracts. We are asking the council members to consider a motion to approve the path forward for contracting with MTSU based on this revised budget plan and revised budget or grant project.
Thanks, Sean.
Also, I'm sorry.
You actually,
Just quick.
No, go ahead.
I'm sorry. I just want to quickly say that one, I've invited Dr. Chafin with MTSU to be here, so she's also available to answer any questions. And then lastly, MTSU is committed to making this work. So, you know, if for whatever reason the council doesn't approve this project to move forward, they are committed to addressing any issues that come out of your concerns to make sure that we can find a solution to make this work. So thank you.
All right, thanks, Sean. You explained that where I could understand it, so that's a pretty high bar. I greatly appreciate it. Does anybody have any questions for Sean? This is, if I'm not mistaken, Sean, are these the last two contracts that
That's
we have
right.
to get finished? So I want you guys to think about the gravity of that a little bit. All of those grants that we awarded in March of last year, this is the last of the two, to be contracted. We've already got money in the community, as you saw with our previous slides, and this will finish up the contracting from our first round of grant cycle funding, which, again, I'm thrilled about. So does anybody have any questions for Sean or Dr. Chafin? Okay, hearing none, I will entertain a motion if somebody, I'm sorry, Dr. Fournette.
Yeah, I mean, the main concern I had was that you've took out multiple vans, and it just ends up that the amount is exact by increasing the mileage is exactly the same amount. It just seems odd to me.
How so?
Well, it just, for it to be the identical amount number, it just seems a little funny. I mean, you'd expect it to be a little different, you know. I'm trying to get my camera work. I'm sorry, but
that's okay.
It just seems, you know, you'd expect it to be some variation in the number, not the exact same dollar amount.
Dr. Chafin, would you care to address that? I think I understand, but I'm not a very good explainer.
Yeah, I'm very happy to do that. So our understanding was we don't want to change the entire amount of this contract. What the review board approved was a set amount, and we were trying to stick within that same amount. Had it been significantly different with what we saw with the actual mileage, we may have consulted with Sean and said, hey, this looks like there's going to be a big variance. But since we're still somewhat projecting, we haven't been able to capture data for 12 months because this project really hasn't been going on for that long. But with the available data that we had one slide. I'm not sure if I saw it come up, but it had some yellow highlighted sections on it. Just looking at those two contracts, the difference in actual mileage and revised mileage for one quarter was $500 for one contract. The second contract, the difference, the average over 3 months was within $600. So we still, at the end of the day, may wind up either a little bit over or a little bit under. We really don't know. We're still projecting because this project hasn't been fully implemented. So the reason for the exact amount was trying to stick with what the committee had originally approved rather than having to approve a brand new budget with a different total. And since it seemed to be within a couple of $100, looking at the averages, it made sense to just go ahead and put it in there, knowing that we may be a few hundred over, we may be a few hundred under. We just don't really know yet, but it's certainly within the ballpark.
And so anything over, then obviously the entity providing the services would eat. Anything under would just be money that wasn't spent, that was allocated. Is that accurate?
That is accurate. Yes.
Okay. All right. Thank you. And I think Lisa, that I saw your hand raised, and then I'll get Dr. Moore, but I'm pretty sure I saw Lisa's hand.
Yeah.
I'm
you
sorry,
did.
Lisa
Thank
Tipton.
you.
Okay.
Yes.
Oh, you're welcome.
Thank
Go ahead,
you.
Lisa.
Okay, so I have a question about that as well. I did see the list of, I'm guessing, employee-owned vehicles that would be available to do that transportation, which looked like it would break down to roughly $1,900 a month of mileage between all of those different vehicles, which seems reasonable to me for the amount of mileage all those different vehicles. Does have Hustle Recovery demonstrated the ability over time to hire and retain staff who, one, are willing to use their personal vehicles and be reimbursed for the mileage, and two, is there a process in place similar to Department of Mental Health and Substance Abuse, where there's certain things that you have to check off, like an F endorsement? The person has to provide their driving record. They have to have their own liability insurance. Then the aggregate policy picks up after that. Or one, the demonstrated ability to have that many staff with personal vehicles they're willing to use to that extent each month, and two, is there a process in place where all those boxes are checked for those people to be providing this service?
Okay, thanks, Lisa. Would you care to address that, Cindy?
Yeah, I'll be happy to. And then I may ask if Troy can also weigh in on this, because I know he's participating on the call as well. It was my understanding that with the previous slide, the other vehicles that were purchased primarily for these grants, that would be the primary means of transportation. These would not be the sole means of transportation for these projects. They will supplement. But there were other vehicles that were purchased that you see on the screen specifically for these two grants. So I don't think it's going to be I think it'll be more of the exception than the norm, that the personal vehicles are going to be what's used. These are going to be primarily, it's going to be the owned vehicles that are used, and then the others they'll be utilized, but not like the ones that are specific to the grants. Troy, would you please share some feedback on that as well?
Yes, ma'am. I'm sorry, I'm Troy Senator. I'm with Hustle Recovery. The unowned vehicles, from time to time, we have situations where maybe our vans are tied up transporting someone and we need to get someone to an appointment, or maybe we get a call while our van's out and somebody needs to be picked up for respite. At those times, these employees that own these vehicles that already work for me would go out and make those runs. I've had them all covered for years now under a hard auto liability policy. In order for them to use these vehicles, they do already have an ELF endorsement, and they do have liability insurance at a minimum on the vehicles, if that helps.
Thanks, Troy. Lisa, I am way out of my league here, as you probably know as good as anybody. Did that answer your question?
Yes, it did. Thank you.
All right, thanks,
Yeah,
Lisa.
I just add, we've been operating like this for a while, so all the attorneys that we have, like, there's been several people and entities comb through everything that we do to make sure we don't make a mistake to end doing the good work that we already do, if that makes sense. So yeah, we've had all that's been in place for a very long time, and we continue. That's part of our policies and procedures, is that's what's got to happen before someone can drive a client.
All right, thanks, Troy. And
Yes,
Dr.
sir.
Moore, I think I saw you as well, sir.
Yeah, thank you, Stephen. I guess I got a little heartburn because all this changes that are going on as far as the vans that were going to be purchased, and now they've taken the vans out, and now we have a list of all these 18 vehicles that they're going to use. But the more I've thought about this, you know, they're doing great work. You know, the overall grant that we've given them is the total of the two is 8.6 million. And so this is a small percentage in comparison. I think based on what I'm seeing, that they have methods of tracking the mileage and making sure that it's fairly reported. And, you know, I feel pretty good about moving forward on this, even though I struggled with it initially, just because we had already approved the grant and now we're changing it midstream. But only a small amount are we changing it as far as what's happening. So I would move approval.
Thanks, Dr. Moore. I have a motion to approve. Do I have a second?
I'll second it.
I'm working on my voices again. I think that's Brian. So I have a second from, all right, Brian, I'm getting better, brother. All right, is there any discussion? All right, hearing none, Mary, would you proceed with the roll call vote?
Armando Fontes, Brian Buck,
Yes.
Casey Cox, Sharm Allen,
Yes.
Clay Jackson,
Yes.
Karen Pershing,
Yes.
Ken Moore,
Yes.
Lisa Tipton,
Yes.
Mike Flynn,
Yes.
Shane Sexton,
Yes.
Stephanie Vanterpool,
Yes.
Steve Lloyd,
I'll abstain.
Tim Fournette,
Yes.
Tommy Farmer,
Yes.
Wayne Wyckoff.
Yes.
All right, so the motion carries, and thank you, Sean, for your hard work here. It was a lot to get through, and I certainly appreciate everyone's concerns and ready to get this money in our community. So thank you all. All right,
Yeah,
Mary,
thank you.
our next. Yeah, Sean, thank you. I mean, if I can understand it, you've done a heck of a job, sir. So I'm impressed. Next up, Mary.
All right, next up, a request for a discretionary fund and an audio visual request. So the OAC office is requesting an annual discretionary fund from the Opioid Abatement Council. The first item here is for in-person lunch meetings and a holiday dinner. And then also a request for the OAC member recognition plaques as OAC members roll off the council. And so we're looking at about $2,100 a year. The second part to this request is an OWL camera. And as y'all all know, the Tennessee state law requires audiovisual capabilities for attendees if any council members attend virtually. And we are also required to rotate in person. Rotate the in-person meetings across all grand divisions. So there are times when we can spend up to 20 hours working with an agency to determine whether or not they have hybrid capabilities. And a meeting owl would improve those audiovisual capabilities. So we used one of these in Chattanooga. The AIMS Center had one, and I have some more information on this. It includes a camera, it includes a microphone, and it includes a speaker. And this is what we receive in the box. And what's interesting, Dr. Lloyd, you may like this, we can turn the eyes off. So you can turn the eyes off so that you don't see the owl looking at you. And the feedback that we received from using the owl in Chattanooga was pretty positive, but I feel like after we get it and get to know it and where to place it in the room, we would have really good audio visual for those that attend virtually. So that is the request. I'll turn it over to you, Steve.
All right, thanks, Mary. And I noticed that thing in Chattanooga at first. It spooked me, but I got used to it over time. Does anybody have any questions for Mary around these expenditures? Dr. Moore?
Well, I'm a little confused exactly what the discretionary fund amount is. If it's just the 2180 plus the camera, I think that really handicaps staff, I would like to see us figure out a number to have some ongoing discretionary funds so that we don't have to come back and see these nickel and dime expenditures sometime.
So the annual request is 2,100, and then the camera is $2,000. So the camera would be one-time expense. There's no cost for the system upgrades. So just putting that out there.
Mary, I think what he's saying is that we want you to have a little bit more cushion of flexibility within reason, so that it's not like, oh, we actually added another staff member or took a staff member away, that you have to add another $50 for a plate. We don't need you to come to us every time you need to add $50, but within reason. So if there's a budgetary amount where there's $2,500, where there's $3,000, that is a drop in the bucket for the good work that you all are doing as administrative staff. And it's, again, this is to be very clear, this is not a quote unquote reward for administrative staff. This is discretionary funds, just like you would have in any other office setting. And we need to be fiscally responsible with it, but I don't think we need to be so limited that you're wondering if you can have paper plates or, plastic forks. I don't know. So things like that.
Thanks, Dr. Vanderpool. Dr. Moore, did you raise your hand again?
I did. I think it ought to be about $10,000. And we're going to
see. So is that a motion?
Yes, it is.
All right. And so just so y'all know, we actually talked about this. I got out of the habit a long time ago, mainly at the I guess the concerns raised by my wife, that I not try to read people's minds. And so we wanted to bring this for you because I did not want to do anything. I didn't want to do anything unilaterally. So we've got a motion on the floor for $10,000 worth of discretionary funding spending at the discretion of our executive director. And the only question I have, Dr. Moore, is that a yearly, a one-time amount, or what is that?
That's a yearly amount, and I would anticipate as far as our quarterly meetings that there be some evidence or some submission of how much money was spent out of that discretionary fund, just as a report to the board.
Okay, so I'll try to restate Dr. Moore's. I'm sorry. Go ahead, Stephanie. I'm sorry, I didn't see your hand.
I have a quick question. I didn't have a hand up, but is there a does that, Dr. Moore, would that include the pricing for the one-time owl for this year? Because I think we still need to be responsible. If the owl is going to cost $2,000, out of that, will they be able to use that discretionary amount to include what they're requesting for the audiovisual one-time purchase? Was that how you envisioned it?
$1,000 or so.
Oh, sorry, Ken, we cannot hear you.
Oh, I'm sorry.
Now we can.
I would say it would include the owl, and that would still leave additional money in the discretionary fund going toward the end of the year.
Okay. So let me restate the motion before I entertain a second. So there's a motion on the floor for $10,000 annual discretionary fund at the discretion of the executive director, with a quarterly report of invoices for the money that was spent during that quarter. And this does include the purchase of the scary owl camera. Is that correct, Dr. Moore?
Yes.
Okay. I've got a motion on the floor as stated. Do I have a second?
This is Sharm, I'll second.
Okay, thanks. The General got a second by General Allen. Is there any discussion? All right, hearing none. Mary, would you proceed with a roll call vote?
Armando Fontes, Brian Buck,
Yes.
Casey Cox, Sharm Allen,
Yes.
Clay Jackson,
Yes.
Karen Pershing,
Yes.
Ken Moore,
Yes.
Lisa Tipton,
Yes.
Mike Flynn,
Yes.
Shane Sexton,
Yes.
Stephanie Vanderpool,
Yes.
Steve Lloyd,
Yes.
Tim Fournette,
Yes.
Tommy Farmer,
Yes.
Wayne Wyckoff.
Yes, and I want the ayes.
Okay, the motion carries, and Wayne, if I look up there and see your eyes, that'll be it. I'm not sure I'll be able to take it. There we go. Lord have mercy. All right, thank you guys for doing that. After reading several newspaper articles of what's going on in certain areas of our state, I would have brought a pack of bubble gum before you all until we made a decision on this, just so you know. All right, Mary, can we proceed with our next item?
Yes, so I've got a couple of topics that are going to lead up to the request for a motion, but wanted to give some updates and some background information. So first, an update on the House Joint Resolution. This is House Joint Resolution 0100, and I have the bit of the content here that says that respectfully urges the Tennessee Opioid Abatement Council in each county that has joined the settlement to allocate a minimum of 25% of expenditures approved from the Opioid Abatement Fund pursuant to Tennessee TCA 3311-103. That's our code 3311-103. That's us, to specific initiatives that save lives via the distribution and promotion of overdose reversal medications until such time as the overdose death rate in Tennessee has been reduced by a minimum of 25%. So, so as many of us know, session has ended. And the House Joint Resolution was signed by the House Speaker on April 24th and then signed by the Senate Speaker on April 25th, just this few days ago. And I just pulled out the history of the House Joint Resolution so you can see the various committees that it wandered through. So, update on that, it has passed. However, we talked with JP at the Attorney General's office, and he has advised that this resolution does not change the statute. So right now, the Opioid Abatement Council office does not have any data on the purchasing, distribution, or promotion of overdose reversal medications bought or funded by OAC funding. Questions related to purchasing, distribution, and promotion of overdose reversal medications with OAC funding are now added to the community grant and community semi-annual reports. So we are asking these specific questions so that we can have the number of units if they were bought and how much money was spent of OAC funds on the overdose reversal medications. So the counties, they're completing their report right now, and we're gathering that information from all 95 counties. The community grantees will complete their second semi-annual report in September. And then by the fourth quarter OAC meeting, I will have self-reported information from the community grantees and the counties on what was bought with the OAC funds. So what I know right now is that and this is gleaned from the community grant semi-annual report that was completed in February prior to us putting these specific questions in, that we've awarded these 113 grants. 22 of those grants in cycle 1 include Narcan or naloxone purchase and or distribution as a component. And they've reported that 15,927 units of naloxone were distributed, but I don't know how those were purchased, right? They could have received it from other places, or they could have bought it with OAC funds. That question was not asked. So I cannot tell you how that naloxone was purchased or where they received it. Some of them told us, but it was not a specific question. So I wanted to just give an update on the House Joint Resolution and the data that we have at the OAC office on the naloxone purchases. So Steve, I'll turn it over to you to see if there are any questions so far.
Yes, thank you, Mary. And we will, we'll continue to follow through on this, as Mary stated, and want to open the floor for any questions. We'll answer them the best we can.
Mr. Chairman?
Yes, Dr. Jackson.
I appreciate Mary drawing up this data. I think it's good data to have. I think it's good to ask for our grantees. But, in true fashion of our dear legislative colleagues, they've left this thing vague enough that I think we've already satisfied their conditions. If you're looking at peak opioid overdose. If you're looking at peak overdose deaths in Tennessee till now, the latest data we have, I think we're already at the 25% cutoff. So I think it's a resolution, doesn't change the statute, and I think we're beyond their resolution's mandate. So I appreciate what Mary's doing, but I think it's gilding the lily. I think I know the spirit the legislature drew this up in, but I think their conditions already passed.
Thanks, Dr. Jackson. And that's, when we looked at this, obviously we wanted to see what are we doing right now. And so, more will come to light on that, but I certainly appreciate what you have to say. Anyone else?
Tommy Farmer.
Oh, I'm sorry, Tommy. I couldn't see your hand, and I always recognize you.
No, I agree with Dr. Jackson. I echo exactly what he's saying. Plus, I think those numbers CDC's reporting is somewhere closer to 27.4%. I think the mandate, and we're subject to being locked into that, and it doesn't change the charter or what the legislation that governs this committee. I would just be, I think their spirit, I think their intent is fantastic in what they're doing, but I agree with Clay. I think we've already exceeded that, and to pass a resolution or for us to say that we're going to continue down that path, and we don't know what the future necessarily holds, I think that would be questionable.
Thanks, Tommy. And Lisa, I'm pretty sure I saw your hand.
Hey, Steve, thank you. Yeah, I just want to agree with Dr. Jackson and with Tommy also to say the spirit of the resolution is definitely very compassionate, but I do think it would be good for us to obtain the information across the different community funded grants of exactly how many of those did distribute Narcan or facilitated the distribution of Narcan, and maybe even go another step into some of the community grants, because some of the projects that I've heard about across our region have been specific to that with some of the county funding. So they were assisting EMS workers, doing some different things. So I think to really look at the breadth of what this council has funded in some way, form, or fashion that ties back to that objective would be something good for us to continue together.
All right, thank you, Lisa, and I'm certain that is our intent. Tommy, did you raise your hand again, or did you have a malfunction of your computer skills? I think I know the
My
answer
hand
to
is
that
down.
I got you. Thanks, Tommy. Does anybody else have anything that you want to add to this? If you follow the numbers, guys, nationally, overdose numbers are trending down and significantly, and that includes the state of Tennessee. We still have two demographics that are either plateaued or still rising, and that's African Americans and Native Americans. So we still have demographics that have left behind, and so we're all headed in the right direction. None of us are, at least in my opinion. And but I am pleased with what we're seeing, because it was like, at some point I didn't know if we were ever going to see it trend down again. So I'm excited about that. All right, Mary, you want to proceed to our next item?
Yes, well, I'm still more on the Narcan, so wanted folks, and I talked to Chairman Lloyd about this. There's more than what we're doing, and I got to hear Tony and his team present last week at the RX Summit with some updated information and numbers about what they're doing as far as distribution and promotion. So Tony just has a few slides. Tony, can I turn it over to you for a few minutes?
You can.
Mary,
Thank you, Mary.
I want to say something before Tony disappoints me even more than he already has. Whenever we're looking at the money that we spend, I think that we have to be cognizant of what our state is doing, so that we become complementary. And there'll be people out there that get on me for having the department present. But I think that's short-sighted, in all honesty, because we need to know what they're currently doing so that we can effectively spend our dollars. And that's why I wanted Tony, because I could do it, but I'm not the expert. And Tony's presentation at the RX Summit I thought was outstanding. Even though he got a haircut, and I wish you could see what I was talking about because his fro was legendary. But Tony, I appreciate you coming and doing this for us. Again, I think you did a great job at the summit.
Thank you, Steve. I appreciate it. We got a good team. We got good stuff going on in the state, and I appreciate the opportunity to present in front of you all. I know I've got 5 minutes. I've already used 10 seconds. So I just want to talk about initiatives around how we're saving lives through distribution of overdose reversal drugs. So as we look at it, that work is done through our TN Save a Life program. Okay, this program provides training education to anyone in the state, anyone. Agencies, facilities, individuals. We'll train anyone and everyone on the opioid crisis, harm reduction, stigma. We do emerging substances trainings monthly at a minimum in all sorts of component of our trainings. And then also, yes, on the use of naloxone and when to use naloxone. In addition to that, one of our core components is how do we raise awareness? How do we reduce the stigma overdose epidemic? And make sure individuals know what resources are available through the regional overdose prevention specialists. They do a lot of media and outreach that's tailored to their respective communities they're a part of. It's not just one state program. They do tailor that to what will work in their communities. And I will tell you, if you've seen one of these, they're all different, but that's on purpose. Another role that ropes play and also some of our care coordinators play is responding quickly in the event of an overdose spike or clinic closure. You can imagine overdose spikes happen across the state, and sometimes they're data driven because, oh, wow, it's more than 2 standard deviations above a certain point within a respective community. That data comes from health or local health department. Also, spikes may be, I don't want to say anecdotal, but maybe it's only reports of. Is it law enforcement or first responders saying something to a rope or saying something to a community coalition or saying something to a health department? That then at that point we kind of spool up what we can as it relates to spikes. In addition to spikes, our ropes as a function of the department's relationship with the HHS Office Inspector General, we've had opportunities to be involved in clinic closures. That's where I get the email on a Friday at noon, hey, are you available for a phone call at this time? Well, of course I am. And then they'll tell us some specific information like what region of state the clinic closure may occur. They'll tell us, hey, this is what the patient mix looks like. And with our partners at health, we'll come up with kind of a strategy of, okay, we need to put, is it ropes and lifeliners that are in that region and kind of station them there on that day we know the event's going to happen. And about 8 o'clock in the morning, one of our law enforcement partners will give me a call and we're able to get the ropes there immediately. You can imagine a spike situation or a clinic closure, the most important thing there is providing naloxone in addition to training connection resources. So that's where they can be kind of boots on ground and really where they need to be when they need to be there. In addition to that, yes, we do the training, we do the outreach, and we do on the spot naloxone distribution training, but ropes do serve as a point of contact for naloxone distribution and testing strip distribution. Right now we're doing xylazine test strips and fentanyl test strips. But what I'll say here is this naloxone distribution piece is not universal. It's really priority distribution focus. That's where we focus naloxone on people who are at highest risk of overdose and the people who are most likely to be in a position to respond to an overdose. And frequently it's individuals that have no other means by which to access naloxone. In addition to the priority population we work with, we also, through the ropes, implement a first responder leave behind program. That's where we empower first responders to have kits they can give to individuals who have suffered from an overdose and maybe don't want additional help at the time. From there, there's a connection to, as we see on this next point, our care coordinators who coordinate with first responders with individuals impact to help them get services. It might be treatment, but it might be even just a connection to an AA or NA group, or maybe it's a connection to SSP. We kind of work with what the individuals are interested in and going from there. Next, please. So here's where, well, a nice little chart. I like this chart because it gives you a really concise look at what our distribution of overdose medication looks like in Tennessee. There are a lot of these community access points. I promise you I won't read them all to you or walk through each of them. but a couple good ones we like to talk about are community service organizations. This maybe includes unhoused service organizations, maybe food banks, SSPs, treatment providers. Our ropes do community outreach. That looks like, maybe is it street outreach? Is it a health fair? I know we're even participating in Bonnaroo this year, which we've done in years past. This isn't just our first year. Maybe is it working with clubs, make sure they have naloxone on site, music videos, or music venues, not videos, sorry. And then also the local encampments of unhoused individuals. And you can see here where, go back to my statement about priority distribution, that's where we're looking at places where, again, people may overdose, or places where someone may need to be in a position to respond to an overdose. And the last 2 points I'll make on this slide are we also provide naloxone treatment centers and treatment providers across the state. And we've started doing some work with our faith-based organizations where we're implementing our faith project. It's a faith-based action for intervention, treatment, and healing program where we do the train the trainer with clergy folk, where in their organizations with the people who attend their services may interact with them different than they would a ropes or someone else. So we're really looking at how do we reach people who we would not be able to reach otherwise. Next. So here's some of our data. I won't go through every single line, but you can see here where we've started from, I think it was maybe, what was that first number? I can't see anymore, Mary. 23,880 in our first year in 2017 up to, it's okay, Mary. Well, yeah, it's fine on my slide. It didn't make it to your slide. Don't worry about it. 23,880 in 2017. In this most recent full year, we did almost 215,000 units. And again, go back to that other slide in your mind. That's where those units went, right? In addition to naloxone, I mentioned fentanyl test strips and xylazine test strips. As a function of a law change in 2023, we were able to start doing test strip distribution to where this year, we're tracking to do about the same numbers we've done in previous years. Xylazine test strips are newer as we think about emerging drugs and what's going on in our state. So in addition to xylazine test strips, we started doing some wound care work as well. Last two comments I'll make. I promise, Mary, I'm almost there. At this point, we've almost distributed 1 million units since program inception, which is incredible. But that number is meaningful. But really, the number that means the most to us is the reversal number. At this point, you can go to the next slide, Mary. At this point, we've had recorded reversals of more than 111,000. What does that mean? Well, the easiest way to say is if you look at Neyland Stadium, that's how many reported reversals we've gotten. Is more than that at this point. And that speaks to the work of our teams, but it's not just our teams. It's everyone in this call. It's everyone across the state. And how, as I mentioned before, we'll work with anybody as long as they'll work with us. And so it's not just us doing it, it's not just them doing it, it's all of us doing it together. I think that's it. There may be a couple of points I wanted to hit that I may have missed, but I think I'm out of time. Thank you, Mary, and thank you to the Opioid Abatement Council for letting me be here today.
Thanks, Tony. And there's a couple of things I'd like to point out. First of all, Mary, I love that slide that Tony has about access points. And Tony, I think I'm correct in saying that we can use that. Is that correct? You okay with that?
Yeah,
and,
it's fine.
And the other thing I want to bring up is I appreciate your effort to get Narcan in the hands of people that we would otherwise have trouble reaching. I think that's, I think at least in my work when I was doing it, that was something that I struggled with at times. So I appreciate that because we wanted vulnerable people. And last but not least, it's just a small criticism. I think that picture of Neyland Stadium as during the Florida game that we checkerboarded and we lost that game. So if you're going to pick a picture of a game, I would prefer that you pick one.
We might have won this one. See, I was at the last Checker Neyland for Florida game. We won that one. So yeah, I was kind of in that blue-white section because those are where I could get tickets.
I got you, brother. Tony, thank you. Does anybody have any questions for Tony? Tony, thanks for doing this. I appreciate it.
Appreciate y'all. Y'all have a great rest of the day.
Yeah. All right,
Thank
Mary,
you so much, Tony. Yeah. Tommy Farmer has his hand raised.
All right, Tommy.
I'm sorry, just real quickly. Again, kudos to Tony and the work that they do over there in the ropes. They're fantastic, especially I can comment from what law enforcement is using them. Second part to that, when going back to the previous discussion where we're talking about the 25% and the use toward reversal drugs like naloxone, I think we had to take into consideration the amount of naloxone that the state through mental health and services is already providing. I think that we need to take considerable consideration in.
I appreciate that, Tommy, and it leads us into our next subject because, in all honesty, guys, I struggle with this one, and I've told you all, even though we haven't always agreed, and I've been wrong more than I've been right, I really struggle with what we're getting ready to talk about next. So Mary, if you don't mind to proceed with TIVA settlement payment options.
Sure. All right. Teva settlement payment options. So Teva is a manufacturer, and their global opioid settlement agreement allows for Teva to either pay the states or the states elect to receive Narcan product. And I have the link here to the Attorney General's settlement document, and I've pulled out the little bit that talks about the annual payments or the cash conversion to product. So we actually made, this is the second time we're making this decision. The first time Steve and I made the decision because we had no way to distribute it. We were not contracted with any of our grantees, and Teva did not have a distribution plan. So we have taken the cash for the first 2 years, and now they are back, and we are needing to make a decision by the 30th. They have given us an extension. So there are a few options here. Option number one is to take cash. That is running about $653,000 a year. Option number two, we can take Narcan. That's coming in at about 31,369 kits a year. Or there is a cash and Narcan. We can take some cash and some Narcan. So wanted you to see option number one, cash, option number two, product, option number three, cash and product. So just putting this out here a little bit more. The kits are coming in at about $20, which is a little less than what Tony is getting, but our shelf life is definitely not as much as what Tony's getting with the kits that he's buying. The distribution plan that Teva has is through Direct Relief, and I did talk to them about this. Their current network is FQHC lookalikes, but we can edit this network if we want to. However, I do have some concerns around the reporting. Those reports would need to be created, and I predict if I'm going to have some type of oversight of this distribution that we would need another FTE to manage this. Another option is perhaps taking the product and putting it through, giving it to our Cycle 2 grantees. We have at least 15 community grant Cycle 2 applications for those that are wanting to purchase Narcan or naloxone. So if you guys want to take the Narcan and not use the Direct Relief distribution, there is the option of sending it through to the Cycle 2 grantees. So several things to think about here, but Steve wanted y'all to make a decision. And Steve, I think I'm not sure if I can hear you. You have frozen on the screen.
I have.
Okay, now I can hear you. Okay, so that's what I had. So I will turn it over to you. Thank you.
Well, I was statue-like as I was listening, Mary. I was entranced. Tommy has his hand up, and I think Tommy can probably sum up my angst about this. So Tommy, floor is yours.
I put my hand down, but I would make a motion to take the cash.
Second.
All right.
More.
All right. So
Second,
I've got a motion.
Vanderpool.
I love you guys.
Karen.
All right, I've got to regain order of my committee here. So I've got a motion on the floor to take the cash from Mr. Farmer, and a second by Dr. Moore, and a third by Dr. Vanderpool, and a fourth by Karen Pershing. Is there any discussion?
Call the question.
I've got to call the question. I'm not sure that's exactly by Robert's rules, but I will do that, Dr. Jackson. So, Mary, if you don't mind proceeding by a roll call vote.
Yes. Armando Fontes, Brian Buck,
Yes.
Casey Cox, Sharm Allen,
Yes.
Clay Jackson,
You had me at I need another FTE. Yes. Yes.
Karen Pershing,
Yes.
Ken Moore,
Yes.
Lisa Tipton,
Yes.
Mike Flynn,
Yes.
Shane Sexton,
Yes.
Stephanie Vanterpool,
Yes.
Steve Lloyd,
Yes.
Tim Fournette,
Yes.
Tommy Farmer,
Yes.
Wayne Wyckoff.
Yes.
Okay.
All right, the motion carries. And when Mary said another FTE, I could almost feel Clay coming through my phone. So I was correct in my assumption. So thank you. And thank you guys for that. All right, community grants, cycle 1 reporting.
Yes, so this is our last topic. There was a question at the Chattanooga meeting for some more data. So just setting this up, there were 116 approved grant awards. There are 113 which will implement, 111 executed contracts, soon to be 113, and right now 93 launched projects. So just to let you know where we are with the data that we are receiving. The grantees are completing a semi-annual report. We received 103 of those semi-annual reports completed and returned. This is fantastic. They've given us lots of good data. We were able to pull that data out of FormStack, export it into Excel, and we are making maps. So here we are. This is the Tennessee County served by Opioid Abatement Council's Community Grant Cycle 1. A real quick description on the legend. Each number represents the total number of grantees serving a county within an OAC funded program or project. So you're able to see how many OAC funded programs or projects are in the counties across the state. The legend shows the lowest and the highest number of grantees providing a service in a single county. So there's at least 18 statewide projects going across the county or going across the state. So then we've taken it and we're slicing it by the strategies. So here we have primary prevention, harm reduction, treatment, recovery support, education and training, and research and evaluation. So I did preview these with the council members in their one-to-one. I know we're going through these pretty quickly, but suffice it to say, we have information. We know where the grants are. Okay. So there was another question that came from a council member, and that was the cycle 1 funding per overdose death rate. And our new OAC quality director, he worked on this last week and has some preliminary data. So I'm going to turn it over to David Lewis to present these next 2 slides. David? And y'all be nice.
So we took 2 approaches to examining how the funding is being distributed. With the first, we looked at the amount of grant cycle 1 funds by 2023 county opioid overdose death rate. And to do this, we took the number of counties served by each contract and divided the total amount to get the amount to assign to each county. And the extreme being for statewide grants, that was divided by 95. For each county, the amount of funds from all contracts serving that county was totaled. For the chart, counties were sorted highest to lowest by the 2023 opioid overdose death rate per 1,000. Then we grouped things into 5 groups or quintiles, and we can see by looking at that more funds from Community Grant Cycle 1 are allocated to counties having the highest death rates. If you combine the first 2 groups, 57.6% of funding is allocated to those 2 groups versus 42.4% is allocated to the 3 groups of counties with lower death rates. Slide, please. For the next visual, we looked at just flat number of deaths. So we divided the amount of community grant Cycle 1 funds by the number of overdose deaths in 2023 for that county. And then, so 5 is the darkest shading is for those with the highest death counts, and the highest amount per death counts. And the lightest shading is for the 19 with the lowest allocated amount of AOC Community Grant Cycle 1 funding. And you can see when you do it this way, the large counties like the Big Four, Davidson, Knox, Shelby, Hamilton, they, because the number of deaths is quite high, they don't show up as being higher. They're actually in the lowest group. Of course, we'll be trying to analyze these issues every which way we can, and I welcome any questions.
Thanks, David. I appreciate you doing that. Dr. Jackson?
I'm the reason you had to do this, and so I'm sorry, but I want to thank you for doing it. In my opinion, this is the most important slide we have seen, except Stephen's faces of people that are dead that he puts in front of us all the time. This is a critical slide because this, to me, is the metric that matters. How much money per dead person are we putting in a county? Because that's where the money needs to go. And, you know, I'm sitting here, guys, and I am not hopping mad, but I'm highly motivated because, you know, the county I live in is a 1, meaning we didn't get much money per dead person. We have a critical need. We're not getting a lot of money. So the last time that we voted, and this is just a shot across the bow for our next meeting when we get really serious about allocating resources in round 2. The last time that we did this, unless I was asleep at the switch, we put a lot of stock in our scoring. An 83 was different than an 82, or I do not believe that we have the rater reliability or the intra rater reliability statistically to really make that make sense. I think the scores are valuable. I don't want to be misunderstood here, but to say that 79 is different than 82, I don't think we have enough data to know that. I don't think we've studied the scoring process enough to know that. I want to use the scores. I do think there should be a minimum score, but I think in this next round, we need to put a lot of thought into this graph. And if we have counties that are represented in those grants that are 1s, we need to take a hard look before we say no with those counties. And I will stop now, and my voice is raised, and it's just the passion of the cause. I love all of you, but I thank you for doing this work, David. Thank you, Mary, for answering my question.
Mm-hmm.
Promise
Absolutely.
you this is the chart I'm going to look at when I vote next time.
And so,
Clay, thank you. You know, when I worked for the state, it was one of the things that I struggled with because, you know, unlike some folks on here who I really, you know, look up to with regards to statistical analysis and, you know, the scientific process, that's really never been my strong point. And so, you know, the worst county in our state for NAS, you know, babies being born dependent at the time I was at the state was actually Campbell County. And that was on a per capita basis. And if you looked at the raw numbers, and I'm not discounting you guys don't get me wrong, I'm not discounting, you know, these children that were born dependent, but it was a really small number. And when I went to Shelby County and I went to, you know, in some of the Memphis area NICUs, the raw numbers were massive. Yet on my list of NAS counties, it was way down. And so I think this is a really, really important slide because we're looking at the raw number of people. And I think that's important. And I agree with Clay on that. And thank you all for doing it. I asked Mary for some of this, and I apologize for the work that needed to be done, but you can kind of see this visually that we're trying to match our dollars with where our people are that are hurting. And so Clay, thank you for pointing that out. And I think I may have cut somebody off, and I'm sorry I didn't see your hand.
It may have been me.
Okay, I'm sorry, Mary.
No, definitely not. So let's see here. There were a couple of other slides. I'm just recirculating the Department of Health maps. These have not been updated. I'm sure they will be updated very soon because they've got their data out, but y'all have seen these. This was new in their most recent report. This is not opioid specific. This is all drug, and you can see the decrease and you can see the increase. And then folks have also asked, where is the Department of Mental Health spending money and opioids related? I've shared this one before. So I bring all of this up and, kind of based on what Clay was saying, I've also, in my conversation with Stephanie, how do you guys want to see, do you guys want to see these packaged in a different way? Do you want to see it sorted by grand division? Do you want to see it sorted by the maps that we have? So I'm just throwing this all up here to ask, is there any direction from the council for the office as we are planning to package these applications for cycle 2? And just as a reminder, this one right here, this spreadsheet right here is what it looked like last year. This spreadsheet right here, and it was rank ordered from the highest scoring to the lowest scoring, and you'll see which ones have a passing score. So I'll turn it over to you, Steve. Thank you.
Hey, thank you, Mary. And I'm not sure to, how this is in a motion and a vote unless somebody can, figure it out. I think, what we want to know is, first of all, for me personally, I think the data is useful, and I think it's useful the way it was presented. Are there any recommendations as to how we package this when we share in our individual meeting, not individual, but Mary's individual meetings with you, and then at our council?
Tim Fournette has his hand.
All right, Doctor.
Well, we have several.
Okay, thanks.
Well,
all right, go ahead, Dr. Fournette.
Is there any way we could have the scoring system from 1 to 5 listed on in another another area, so we could actually see what number they were and what the death reduction was per the money spent in the slides when we look at it this next time?
Yeah, absolutely. I can add a column, just how there's a column for meets needs assessment, checked recovery housing. I can add a column with that information that David Lewis presented.
Thanks, Mary. Thanks, Dr. Fournette. Dr. Vanterpool, I think I saw your name up as well.
Yes. Can you, Mary, go back up to the 1 through 5 slide and the slide right before it, please?
Which one? I'm sorry.
So the one, there was the slide with the 1 through 5, and then the slide right before it. I wanted to look at the slide right before that first. Yeah, that one. Okay. So estimated percentage of OSU. So how does this slide relate to the following slide? Are they in quintiles, or is the following slide just strictly funding per opioid overdose death rate in the county?
David Lewis.
Yes, the first slide is quintiles by the death rates, and then the second slide includes also broken into quintiles. You end up with, when you divide 95 counties, you get 19 counties per group. And the first one we presented in a chart format because it's really hard to show both death rate and the funding. You'd pretty much have to look at two maps side by side, but we can work out a way to try to make that available for the next meeting if it would be helpful.
So this may be semantics, but I just wanted to go back to the map slide, please, Mary. This may be semantics, but I just wanted to give some some thought on how we could represent this for clarity for those who are both watching and also council members when we're reviewing this. When we have slides 1 through 5, we're saying that the darkest one have the most, or number 5s have the most amount of OAC Cycle 1 money allocated per overdose death, correct?
Yes.
And then 1 has the least. So my recommendation would be, if there is a instead of the gray box to the right, have a maybe a table or a bar chart, and having the ranges of dollar amount, if you're able to. I'm sure you'll be able to have that from there. So deaths per county, or the dollars per county, maybe it's $25 to $100 per county. I think that'll resonate a little bit better when you're presenting this data outside of the council or to the general public. Because this is, while this is great work to get this initial value, I think we could present it even more clearly. So if you, for example, instead of having that gray box to the right, have the actual range of dollar amounts, like a histogram. So this is, you know, $15 to $20 per opioid overdose death. This is $100 to $150 per overdose death, and then quintiles 1 through 5. Does that make sense? And that will help us when we review the applications. We can see, okay, we have a grant coming in for $2 million to a county that had that had only $10 per overdose death funded in the previous cycle. It makes it resonate more. It makes it less abstract and more concrete.
Absolutely.
All right. Thank you.
Steve?
I'm sorry. I'm sorry. I pulled the Shane section there. I didn't mean to do that. Dr. Jackson, do you have your hand up?
Yeah, I'm not sure we need a motion and vote on this because this is not making a decision about funding or spending, et cetera. I think in my view, we're just advising Mary and her staff how to present these data. Mary, I like the top to bottom score. I'm not against the scores. I think if we add this column, and you can offline with Stephanie about how, you know, if you understand what she's saying about the granular detail of the dollars, that's great. I think the 1 through 5 certainly helps me. I would also like to see it arranged by grand division. So maybe that could be a separate cut of the data that we look. But, you know, once you get the spreadsheet set up, you know, you can hit 1 or 2 buttons and make it pretty easy for us to see that. I do think the grand division is helpful because we received a lot of criticism about that last time. We also received criticism from putting big grants into big universities, et cetera, and not getting small grants done. I reviewed a grant for $15,000 for a van, and my sole mission next time is to make sure that that $15,000 gets funded for that van. It is a $15,000 grant. So, you know, whoever those people are, I think they deserve that $15,000. So, you know, I think playing small ball is good here. Yeah, that's just one bias out of 15 council members. But I agree with what's being said. I don't think we need to bind your guys' hands with some kind of motion here or a vote. That's my opinion. I would yield the chair on that. But those are my thoughts based on what you guys said so far.
Yeah, thanks, Dr. Jackson. And the chair agrees. I think I know Mary pretty well now. I think Mary threw this in here for discussion purposes anyway, so we could get some feedback how we can better relate this to you. So I appreciate that, Dr. Jackson. Did I miss anybody else's hand up?
Lisa's is up, but I don't know if it's from earlier.
Well, I'm not going to take a chance. I never want to miss. All right, it's all you, Miss Tipton.
Okay, thank you. I did just want to say thank you so much to Mary and her staff. I feel like those charts were fabulous. That is a lot of information, and I think it was presented well and clearly. So thank you. I did also just want to draw a little bit of attention to the money given to the county. And while we're on the focus of this call, I have not gone back and looked at Shelby County or some of the counties in the West Grand region compared to other counties to see if it's somewhat equitable with population density? But I would assume that some of those big old counties got quite a bit of money allocated to their counties. And I feel like it is worth looking at, getting some information on, maybe even having a little bit of reporting back of what have those counties chosen to do with their money. Who do they trust, whether it's the $15,000 people for a van or it's a very large organization, because they truly have the capacity to meet the guidelines and the expectation of the council, whether that's for reporting, whether that's for auditing, whatever it's for. And I think that might be worth looking at as well, because while we're not granting those grants, we have put out stipulations to the county and they do report back to the council. So I think that while we want to make sure we're acting equitably across the state for the decision-making capacity that the council has, we also are not the only source of money. So what are some of these very light colored, low colored numbers counties? What are they choosing to do with their money? What are their county commissions doing? What are the organizations in their community doing? And I think that would be worth knowing as well.
Thanks, Lisa. And I like to know that anyway. Regardless of everything else. And, as you all know, we know down to the penny how much they get. We had our most recent county funding hit recently in the past couple of months, and we can tell you that down to the penny. But as far as what they're choosing to spending it on right now, I haven't seen that. So, Mary, that may be something that we can look at and talk about and see how we start to compile that, going forward. So I appreciate that, Lisa. Anybody else have any comments?
Tommy.
Oh, I'm sorry, Mr. Farmer.
No, I agree. I echo what Lisa's saying. I agree all the way around. And I don't think we can have too much information here. But yes, what the counties are doing, not necessarily what they're doing with the money. We can't control that one. They have a larger share there than what we do. But how much money they are getting. And then, of course, just like in the following slide there, the percent increase, I like that, Mary. I think your staff, kudos to you guys for putting these others in here in the all other drug overdose deaths. And then the resources coming out from health and mental health to those regions, because it also helps us to paint a more comprehensive, complete picture of what's going on. And then I would only add one final thing, is to make sure we're comparing apples to apples and not apples to oranges on our date ranges. When did our grants go out? When did our money allocations go out? And when they went into effect versus when these overdose stats were tabulated and what we have access to.
All right, thanks, Tommy.
Stephanie.
I just wanted to thank you. Just wanted to reply to comment on Lisa's request for the county funding reporting. Is it? Can you remind me, Mary, what the SMART initiative is doing with regards to helping us getting that data? Is that part of the data that they are reporting on, or is something else?
It's not what they're reporting on. They're helping us get the semi-annual reports completed, but we have a stock template of what the counties submit to us. SMART Initiative's primary goal is to help the counties figure out what to spend the money on and make sure that they have the resources, the knowledge on what to spend the money on.
So that's more future facing as opposed to retrospective.
Right.
Yeah, that's what I was thinking. Dr. Vanderpool was that is more future facing, and what we hope to see is these dollars being allocated in a way that helps them build this recovery ecosystem that we've talked about, and it's nothing against county commissioners or mayors. I mean, this is not their area of expertise, and so what we'd hope to see is some of the funding that's spent, start to build these ecosystems, because it's complicated. Again, we're not cutting out gallbladders, and I'm not knocking, my surgeon colleagues, but it is a complicated system that we want to see dollars allocated in a way that helps us build this system. So I hope that we start to see that with some of the reporting that comes in on the back end after they've made these decisions on how to spend the money. So Mary, does anybody else have their hand up? Because I can't make the tunnels now, so I got back on the road, and I'm a little scared to keep looking down.
Wayne.
Okay. Oh, I never want to, I never want to miss Mr. Wyckoff. Mr. Wyckoff.
Thank you, Chairman. How about rate of change year over year of deaths versus county population? That would tell us who's trending forward and who's trending back if we don't have that data.
Thanks, Wayne. All right. Anyone else?
I don't see any other hands.
Okay, thank you, Mary. And I think that was our last agenda item before public comment, correct?
That's right. I've got the public comment slide up right now.
All right. So as you all know, Tennessee is an Open Meetings Act state, and we do have time allocated in our meetings for public comment. If you do have public comment, Mary has the slide up to tell you how to do that. We would ask you to limit your comments to 2 minutes or under. I won't necessarily cut you off unless I have to. And remember that this is not a question and answer session, although offline we do try to do our best to help people from things that come up. So Mary, is it open for public comment? And if it is, does anybody have their hand up?
I am presently not seeing any hands raised.
Okay.
I have one hand raised. One hand raised.
All right. Can we recognize that person?
Chrissy Zitka, you may come off of mute and turn your camera on if you'd like.
Yes, hi. Thank you for your time. I just wanted a quick comment, and I apologize for the new gentleman. I'm so glad to see him on staff, David. But I believe the death rate is per 100,000 individuals, not per 1,000. I just wanted to comment to that effect.
Thank you, Chris.
Sure.
All right. I do not see any other hands raised.
Okay.
Still do not see any other hands raised.
Well, unlike a wedding, you don't have to forever hold your peace, but you do have to hold it until our next meeting. So with that said, it's my favorite part of every meeting, which of course is adjournment. Do I have a motion to adjourn?
Motion, Tim Fournette.
I got that one, Dr. Fournette. I got your voice now. So got a motion.
Is a second.
All right, motion by a second by Shane Sexton. Any discussion? Okay, hearing none. Mary, could you proceed with the roll call vote?
Armando Fontes. Ron Buck.
Yes.
Casey Cox. Sharm Allen.
Yes.
Clay Jackson.
Yes.
Karen Pershing.
Yes.
Ken Moore. Ken Moore. Lisa Tipton.
Yes.
Mike Flynn.
Yes.
Shane Sexton.
Yes.
Stephanie Vanderpool.
Yes.
Steve Lloyd.
Yes.
Tim Fournette.
Yes.
Tommy Farmer.
Yes.
Wayne Wyckoff.
Yes.
All right, the motion carries. The Opioid Abatement Council emergency meeting of April 28, 2025 stands adjourned. Guys, enjoy the spring. We'll see you all next month.
We'll see you in June. All right. Ella, have you stopped the